Hello out there in television land. Welcome to yet another edition of It's Your Health. Philip Benyo here with my bride, Kathleen.
What do you mean another one? Like this is so many. It is so many.
It is so many. We've been doing this for decades now, haven't we?
Yeah, I think so.
Okay. Well, make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. We'll be right back after this brief commercial message. And remember to call our sponsors and tell them you heard it on It's Your Health, your healthcare provider.
Well, welcome to our first segment, and I wonder if you're carrying around an umbrella, because we have had a lot of rain lately, and as you can see, that fish is swimming
Yes.
up high. And today they're calling for more rain tonight, so it's continuing and continuing.
On my way over, it was raining so much, it was raining cats and dogs, and I stepped on a poodle. So, moving right along.
Why don't you be quiet and I'll do a headline?
So I feel like I'm at home. Jeez, oh man.
It's very close. Okay, first headline. Antidepressants to aid in smoking cessation. Cigarette smoking is the leading cause of preventable disease, disability, and death in the United States. Antidepressants offer an alternative to first-time smoking cessation medications. Further insight into the effectiveness and potential harms of antidepressants for smoking cessation is valuable because of the significant worldwide morbidity and mortality caused by tobacco smoking. And we should know that.
It's pretty difficult to cut that habit, I'm certain, and we see it all the time. It's many a New Year's resolution that goes unanswered. But the use of an antidepressant somehow changes the brain chemistry, and patients are probably most successful in taking a pill, if you will, that somehow eliminates that craving and that need for cigarette use. So keep it in mind if we come after you and say, I know you're not depressed, but we'd like to give you an antidepressant such as Wellbutrin that is very successful in tobacco cessation.
Saw palmetto for the treatment of lower urinary tract symptoms due to benign prostatic hyperplasia. That's a long introduction, but basically, symptoms of urologic obstruction and irritation affect about 1/4 of men in their 50s, 1/3 of men in their 60s, and 1/2 of men in their 80s and older. Using plants and herbs for this condition is common worldwide. Saw palmetto is one of the most common that is used. Tell us about that.
But ineffective. And so BPH, benign prostatic hypertrophy, frequency of urine, urgency, not feeling like you empty your bladder, getting up in the middle of the night a couple times. People don't like to take medicines, so they tried herbal agents such as saw palmetto, and according to this article, it's really not effective. You may do better with something like Flomax and Proscar. Of course, get to see your doctor and make sure you get a PSA to evaluate for screening for prostate cancer.
I don't even know what saw palmetto is.
It's an herb that's over the counter. It's from the palmetto tree, actually.
Okay, thank you. All right. And now I'm going to tell you about a wonderful Hungarian spice. And I say Hungarian because I am Hungarian and I'm spicy. Anyway, paprika is a bright red spice that adds lots of flavor to any dish that you make. And the paprika comes from the peppers, and it's all ground up and made into paprika.
Okay, I'm going to borrow the pen here, sweetheart. I'm going to make a map of our home. I want you to put where the kitchen is. Can you put an X where the kitchen is? Okay. So.
I can put an X where something is, but it won't be the kitchen.
All right, moving right along.
Okay. A new name in the treatment of obesity. Boy, is that getting popular.
Well, of course, most of us need to shed X amount of pounds, another New Year's resolution, and it's very difficult in today's world. Of course, Ozempic started the bandwagon for these new medications that change your hunger, if you will. It basically tells your brain, I'm not hungry, and you can look at a Stromboli and say, well, not today. And people do shed a fair amount of weight on these medications. Now, they certainly came out first for diabetes, like Ozempic, but this particular one is approved by the FDA only for obesity, called Zepbound, which means you might be able to get approval on a easier basis for that. So keep in mind, there are ways of shedding weight.
Wow. Okay. This is a really important one, I think. People don't think about this. Oral health and cardiovascular disease. Periodontitis is a bacterially induced inflammatory disease that destroys the connective tissue and bone that support the teeth. In other words, your gums might bleed, and you might think that that's perfectly normal. It's not. It's not normal for your gums to bleed. It is estimated that roughly half of all adults in the United States have mild to moderate forms of this disease. Mounting evidence suggests that chronic inflammation increases the risk of cardiovascular disease.
Yeah, bad teeth will lead to bad hearts, and it's an inflammatory process, and it's something that you really need to take care of. Now, it's very unfortunate that as we age and get on Medicare, guess what? Your hearing goes, your vision goes, and your dentistry goes. None of these are covered by Medicare. But it's very important to get your dental health because there's strong evidence that these types of problems with your teeth can lead to cardiovascular disease, strokes, heart attacks, things you want to stay away from.
Yep. And people, you know, when I was a kid, nobody cared about that much about your teeth, and you got false teeth if you had to.
There was no fluoride around, I don't think.
And going from teeth into ultra-processed foods and finding out what are ultra-processed foods. Do you want to tell us about this?
If you took 12 countries around the world that were so-called educated, we are last in terms of healthcare, the last. And the reason why is because 60% of our diet is ultra-processed foods. For example, you could take an apple, which is great, but we end up Frankensteining it into apple pie, which has additives, food colors, preservatives, God knows what else. And these things are one of the major contributors of obesity, high sodium and blood pressure levels, diabetes, and early strokes and heart attacks. So we are actually killing ourselves by our diet. And so you want to get back to basics. Some of the older people who I see say, well, I used to make my own tomato sauce, spaghetti sauce, get the tomatoes themselves and boil them and whatever. And who does that today? You know, nobody has gardens.
But there's so much sugar in all of them.
Right. So what you want to do is, first of all, learn to identify processed foods. Secondly, read the labels. You'll see that on your full screen here. And make sure that you cut back on them. Get back to basics, fruits and vegetables in their raw form, and try to stay away from after we end up processing them to death and turning them into another food that our body has not seen or really wants to see. So it's the fastest half hour in television history at Your Health. We're completing our first segment. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your partner in healthcare.
This is our next segment, and it is devoted to women, women's health, and issues for women. And as you can see from our little cartoon here, the women are happy in the bed, and the man is sleeping on the floor. And you notice in the bed, at the end of the bed, it's empty. Well, we fixed that. We got another dog. So now, instead of having one dog in the bed, we have two dogs in the bed. So that works out really well.
I'm in a different room now, so.
Okay, seriously, what are the essential supplements for women? And we know that there are a million supplements, but these are the ones that you really need. Calcium, vitamin D, and D3, right?
Correct.
Omega-3, folate, iron, magnesium, and lutein.
Right, they all play a role, and you can generally get these things in a one vitamin supplement. Omega-3 has kind of fallen off the shelves just a little bit, although some people use it for dry eyes and other issues. But in terms of cardiovascular help, it really hasn't come up to par.
And you know, it's funny because I just saw my eye doctor, and he said to me, get some omega-3s,
Right,
because they are very good to help your eyes and to keep you from getting macular degeneration, maybe. I don't know. But he likes it.
good.
And going on, women with a history of depression may face a greater risk of heart attack and stroke than men. The reasons for the increased risk aren't clear, but may be related to hormonal events like pregnancy, and menopause that, of course, men don't experience. Researchers found that women with a previous diagnosis of depression were more likely to have a heart attack, heart failure, chest pain, and atrial fibrillation, compared with men who might also be depressed.
Depression is a very bad thing to have along with other healthcare issues because it generally makes and magnifies the other healthcare issues, and this is one of them.
Wow. A previous diagnosis of depression raises the risk for heart disease by 30% for men and 64% for women.
How can you say I didn't experience menopause? I did. I kind of went through it with you, I thought.
Oh, you suffered, that's
Okay,
for sure.
is that right?
Well, I can remember that. You definitely suffered.
Still suffering.
Yes, you are. And here's one that we should all know this name by now. The Mediterranean diet may reduce the risk of early death in women by 23%. Women who closely follow a Mediterranean diet are 23% less likely to die prematurely compared with women who don't. A Mediterranean diet, as we know, emphasizes fruits, vegetables, whole grains, beans, nuts, fish, and healthy fats. Women who most closely followed the Mediterranean diet were 17% less likely to die from heart disease and 20% less likely to die of cancer.
Again, it dovetails with what we talked about earlier. We got to get away from the ultra-processed foods and get back to basics, fruits, vegetables, things that don't require a lot of additives, if you will.
Okay. Women who don't sleep enough could be at increased risk of high blood pressure.
Well, it is very interesting. Theoretically, we should spend a third of our life sleeping. That's when our body and brain tends to reboot. Mm-hmm. And when you don't hit the natural stages of sleep, a lot of bad things happen. And one of them is higher blood pressure.
If you're sleeping less than 7 hours a night, you are upping your risk for developing high blood pressure. Go to the doctor and get it checked. Based on the most updated data, the less you sleep, the more likely you will develop high blood pressure in the future. 7 to 8 hours of sleep is recommended, and it's good for your heart.
And blood pressure, keep in mind, is one of those silent killers. You don't know you have it, but as we age, virtually everyone will have a blood pressure issue. Virtually everyone.
Hormones cause women to need more sleep.
I had heard something about that.
Yeah. And you can have a sleep disorder.
Absolutely.
That could be why you're not sleeping.
Sleep apnea is a sleeper diagnosis, if you will. You have to really have it tested, because people will say, well, I sleep all right. But in point of fact, when they have sleep apnea, the oxygen levels fall. They're unaware of it, but their body is not. And it leads to a lot of premature bad things: heart failure, stroke, heart attack, pulmonary hypertension.
Do I snore?
I'm not in the room.
You lie. You lie.
No, you don't snore. The dogs snore more than you. They have sleep apnea.
And sleep apnea, you don't have to go to some lab or anything to get it done anymore.
No, you can get home tested for sleep apnea, and it could literally change your life if you're diagnosed and treated.
Wow. How your menstrual cycle affects your behavior. Oh, feeling moody or out of sorts? It could be your menstrual cycle. Those hormones impact your emotional health all month long. Want to talk about that?
Stay off this topic.
You want to talk about emotional
I'm not
health?
touching this.
There's just no easy way around that.
No, there isn't, and I do feel sorry for women that have to go through it. In the olden days, of course, we would put patients who were going through menopause on hormones, but that kind of went by the wayside, and so there's very little to do. I'm sure out there might be a lid for your pot, but it's frustrating nonetheless. And it's frustrating that we're ending our second segment already.
Darn, I wasn't done.
You weren't done. You're well done. Don't worry. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health. Call our sponsors and tell them you saw it here on It's Your Health.
I love this one. You see what it says? It says hugging. Number of times a person craves a hug in a day: 13. An average hug should be at least 9 seconds. And to have it have medical healing properties, it's got to be 20 seconds. Hug long and hug often.
All right, it's a good prescription out there in television land.
I'm prescribing it to you.
Oh, okay. All right. Well, I hug my patients sometimes, so I guess that doesn't count.
Doesn't count. Okay. What causes cloudy urine in women and men? It's usually caused by dehydration, a urinary tract infection, or a sexually transmitted disease.
Yeah, sometimes we obviously don't drink enough. I always say that the earth is 2/3 water. Our diets should be 2/3 water, and so are we 2/3 water. And we don't necessarily buy into that. We dehydrate ourselves. So you really need to hydrate. Urine that is foul smelling or changes in color would be a sort of a red flag we'd be concerned about. So if you have urine that's not quite right, then we need to find out why.
And you go to the doctor and you have to put some in a cup.
Yes, yes.
Okay. Does napping affect your risk of high blood pressure and stroke?
Yeah, I had heard that. Maybe you can elaborate on it.
Well, researchers analyzed the data, and some studies suggest that habitual napping could signify a major risk factor for a high blood pressure or stroke. Older females who napped for more than 90 minutes were 54% more likely to have high blood pressure. And there was not a significant association with napping and men figures.
Yeah, well, I'm not sure if it's tied in with sleep apnea. It could be, because people who have daytime drowsiness, one of the first things we would worry about is, do you have sleep apnea? Especially if you're short, stocky, and have a neck circumference more than 15 or 16 inches.
And if you sleep less than 7 hours a day, you increase your risk of stroke in addition to everything else.
I'm not sure napping goes through the stages of sleep that we would suggest are healthy.
What is this that we're doing here? Oxymorons.
Do you know what they are?
What are they?
Why don't you tell us, oxymorons?
An oxymoron. It's two words that go together, but they're opposite.
Yeah.
Like a silent scream, or old news, or plastic silverware. Bittersweet.
There is a list here of 100 oxymorons. Did you see that list?
I was looking at it, yes.
Do you know which
There it
ones?
is.
You know which one they missed? They missed happily married. So, I mean, why isn't that on that list? Tell me.
Oh, it's going to be on a list, all right.
I just need to
But
know.
that's not the list that I'm thinking of.
All right, well, we'll move right along. Sorry.
You're not sorry. Don't pretend you're sorry.
I am sorry.
You're just sorry. What are cataracts?
Oh, good topic.
Oh, cataracts are a clouding of the lens of your eye, resulting in changes to your vision. A cataract can develop in one eye or both simultaneously. It's an experience. By age 80, more than 1/2 of all people in the United States will have developed at least one cataract. You'll have poor night vision. That's what gave mine away. Sensitivity to lamps, seeing halos around lamps, double vision, and frequently having to make changes to your glasses prescriptions.
Now, you had cataract extraction, and
Both of them.
and so it was a positive experience, correct?
Oh, yes, very positive. Doesn't hurt. I don't wear glasses, and I love it. I can put makeup on now.
Oh, you don't need makeup, sweetheart.
Okay. And there are a lot of factors, and they're the typical ones: drinking, smoking, greater exposure to sunlight. Wow.
Yeah.
Family history. And you have to go to an eye doctor to get examined to find out. Not this doctor. He's my eye doctor, but that's not the doctor you want to go to. Make sure your prescriptions are up to date and wear anti-glare sunglasses. Use brighter lights. Okay, I'm done with
Really?
that.
Well done.
Yes. Tell us, what does a panic attack look and feel like?
Yeah, we see this from time to time, especially in the spring. But of course, with society very tightly wound, we're seeing more panic attacks. It can range from a number of symptoms. Most people show up at the emergency room, think they're having a heart attack or a stroke. They have a fear that something bad is happening. They may be shaking. They may be short of breath, rapid breathing, palpitations, chest pain. The list goes on and on. And so there is no real good cure for a panic attack. I think recognizing it, what it represents, is important. And in the old days, we used to have people blow into a paper bag, a brown paper bag, and it would cut down on some of those things because people hyperventilate. But if it recurs and it's affecting your lifestyle, there are medications, usually in the antidepressant level, where you could take to help tone down or perhaps eliminate panic attacks. You should also Make sure you don't have anything wrong with your thyroid or that there's a medical reason for these panic attacks.
And guess what? One of the things you should do to avoid panic attacks? Exercise.
Oh, there you go.
It's always there somewhere, is exercise and deep breathing along with the antidepressants that you mentioned. And you can't really prevent a panic attack, but you can learn to live with it.
Yes, cope with it, recognize for what it is, and go from there. One of the things we'd like to just talk about briefly is cognitive impairment, which is kind of memory issues that we all suffer from time to time, and how that can lead to a dementing illness. Just some facts here that you might want to consider.
Scary facts.
Yeah, 65. That's the age in which most Alzheimer's diseases are diagnosed. And 1 in 3 people who have mild cognitive impairment or memory issues will go on to dementia within the next 5 years. And 2 of 3 people who have Alzheimer's disease are women.
I wonder why.
I think you live longer. Maybe that's, or it's not our fault, okay? Whatever it is. And so that when we talk about dementing illnesses, it's like a big umbrella, and Alzheimer's is just one part of it. And so if you're having memory issues, why don't you get checked, because you could have something that's reversible so you don't go on to a dementing illness. So go out and take care of things, right?
Take care of whatever you have to stay healthy and live long and prosper, as Spock would say.
And part of that is watching It's Your Health. Thank you for allowing us to come into your home, hopefully to inform and entertain you. Correct, sweetheart?
Correct. Always correct, sweetheart.
Oh my, are you ready for your hug?
Yes, I am. 9 seconds.
Is that all I get? Oh my God. Pleasure seeing you.